Yes, I'm Hugh Taylor, a Melbourne Laureate Professor at the University of Melbourne, and I hold the Harold Mitchell Chair of Indigenous Eye Health. I also have a number of other hats. I'm the Treasurer of the International Council of Ophthalmology, the Vice President of the International Agency for the Prevention of Blindness, and also the Vice President of Vision 2020 Australia. I think parents of blind children are really concerned that their children get the opportunity to maximise their potential, and the basis for a lot of that is to have a really good and broad education. I think that the model that Insight's put together is actually terrific. I think there are some children who really do need to have a very specialised, dedicated education program for blind children. But many of the children who are blind or have low vision can actually function quite well in an integrated school system, provided they have the support to help them with the difficulties they encounter. And so to have the hybrid model that Insight's looking at, with some specialised training and some support and mentoring and additional help in the mainstream schools, I think is a terrific idea and a way to move forward. While many of the blind children may not have any change in vision through the rest of their life, there are clearly a number of children who have a relative reduction in vision early on, but their vision will continue to deteriorate. And for these children to capitalise on those early years, to teach them the skills that they will need to have when their vision decreases further, is a very important part of their education process and development. I think that the hybrid model that Insight is starting to roll out is actually a terrific idea. I think there are very few of the blind children today who totally need an isolated schooling environment for the blind. But many of the children with low vision or blindness need additional support to function well in integrated schools. So to have the opportunity for those children who do need that specialised training, and for those other children who need the support and mentoring as they cope with the integrated schools, I think is a really sensible, smart way to go ahead, and I think it really offers the best of both worlds. I think that over the years as an ophthalmologist, I've learnt more and more how little I understand or understood about visual impairment and blindness, and particularly the needs of blind children. And I'm sure that my other colleagues as ophthalmologists or optometrists would equally benefit from learning more about what can be done. And if that's true for eye care providers, then I'm sure it's even more true for other health professionals, whether they be GPs or other people. So I think there is a real need for us to get out throughout the medical field to alert people to the possibilities that can be achieved now, and the support and services that are available to help particularly blind children in their education. I think that I can recognise the passing of the need to have the isolated specialised institutions per se, and the desire to bring children, blind children, children with low vision, into the broader education environment. And I think to offer the bridging and the support that Insight is doing is just a great way to move ahead.